Other questions?
Yes.
Hey, Kathy, here with TV. I was just wondering, are we able to know exactly where this person was tested? Were they tested by a private doctor, or did they receive their testing at a hospital?
I'll let Melissa, do you want to address that?
So my global answer to you is that there is the opportunity for private physicians to do testing once the commercial labs came online. The message from the state health department throughout the entire Commonwealth was that physicians no longer needed to have their approval to submit to the Bureau of Labs. What this results in is physicians throughout the Commonwealth having the ability to submit samples to the commercial labs without communicating with their local health department if they have one. Here in Erie County, we have a local health department. We've worked very hard, and I'm here to say that we have really great working relationships with our healthcare systems and our providers. But this particular message that was put forward during a time when testing became available, I think became confusing for what we wanted to see happen in Erie County versus what was happening throughout the rest of the state. And remember, many counties do not have local health departments. So with that being said, it's resulted in this scenario that played out for us here in Erie County.
Right, so was it tested at a hospital or like a primary care?
It went through a physician's office.
Okay.
I heard someone else who was trying to ask a question.
Yeah, this is Maddie O'Neill from the Erie Times. Is there anyone there who can speak to the precautions being taken to protect inmates and staff at the Erie County Prison?
So thank you, Maddie. In terms of the Erie County Prison, you know, we have we've ended visitation to the prison. There is ways for our prisoners to have virtual visitation with their loved ones. And we certainly have had issues with the flu at the prison, so we've tried to isolate, we have isolated those individuals. And at this point, we don't have any active cases and no symptoms of COVID-19 in the prison, but obviously we are taking all precautions with cleaning and social distancing as much as you can within that type of facility, and everything else that we can do to heed the advice and the recommendations of the healthcare professionals. And we'll continue to do that going forward.
Are incoming inmates being screened or quarantined in any way to prevent the spread within the prison if someone comes in who's maybe asymptomatic?
Everyone who's coming into the prison right now is being screened for temperature. And so that's what we are doing at this particular time.
It's David Bruce.
Maddie,
David, hang on one sec. Are there
do you
any
have one
efforts
follow-up
being
to
made
Maddie?
are there any efforts being made to reduce the inmate population or maybe identify medically at-risk inmates who could be eligible for release?
Well, that is not under the jurisdiction of the county administration. You know, we simply house people once the court system decides who goes to jail. So that would be a question to take forward to our courts, to the president judge and his team.